Hey, practice owners, welcome back to another edition of Coming Back Stronger. We are excited today to have on Dr. David Moffet, Ultimate Patient Experience, who is in Australia, right? So we got a little lag, but I think we'll be fine. And, you know, we were talking beforehand that you're a practicing dentist, you learned a lot of lessons, and then you transitioned into your business or what you do, which is about the patient experience. And while a lot of docs may be watching this and wondering, you know, what the heck are you talking about? I'm not seeing any patients. So what do I care about the patient experience? It is a good time to work on that, to focus on what your patient experience is. And Dr. Moffet's going to share some ideas, the hands-on things you can do right now while you have this gift of time to work on your practice as opposed to in your practice and you're not seeing patients. So with that, I'd like to just really, if you don't mind, turn it over to you. If you would introduce yourself, kind of explain who you are and how you got here, and dive into some nuts and bolts that practice owners can do today while they have the time to set them up to come back stronger.
Stephen, thank you, and thanks for inviting me on your show. I really appreciate it. I hope that your viewers can understand me without needing subtitles along the bottom, because I do have an accent, apparently, they tell me, but I never hear it. Just a little one. What I found is that, and I had my own dental practice for 28 years. I sold it at the 21-year mark and then worked on in it for 7 more years. And during that, even after I sold it, during that time, the business still kept growing. And the reason it grew was because we focused on looking after people and giving them an experience as opposed to giving them just dentistry. We were more concerned on building relationships. So our patient visits were quite long, but their dental treatment in those visits were much less than the time they spent in the office. Our place was a place to come and chat beforehand, have the dentistry and chat afterwards. And that's what we tried to build. We tried to build relationships. So during this time of COVID-19 and having governments restrict the type of practice that we can do, we've had to see a change in our business of teaching dental practices how to grow to teaching dental practices how to survive. Most dental practices out there now are really just trying to survive until we can start business as usual again. But for our patients and for the general public, some of them don't even know that there are restrictions on dental practice. So they're calling a dental office. They've not heard there's a restriction on dental practice. They're not saying, well, I can't call a dental office, so I'm not going to call a dental office. They're still calling as if you can still do something for them. So what we need to do is be available for those calls as if it's business as usual. We need to be able to have the same people there answering the phone and giving different responses, but appropriate responses that keep those people with an appointment, with a clear next step of what they need to do. Now, that clear next step may mean that they need to wait, but we can guess. Nobody knows exactly when this thing's going to be over, but in China, it's over. So we're talking 3 months, maybe it's over. So why can't we make our patients, when they call, why can't we make them a specific appointment in 3 months' time with the framework that if the gates come up sooner, we're going to be calling you. But in the meantime, we're still going to be calling you just to make sure that for the reason that you called hasn't blown up into an emergency, or that it hasn't become something with extreme discomfort that we can't treat in the meantime. Remember, we can treat emergencies that are causing people pain as long as, in Australia, as long as we reduce the amount of aerosol. So that means put the rubber dam on, turn the water down, do it as quickly as possible, get them out of pain, make sure we've got the right documentation that we have done this and that we haven't done, a full mouth cosmetic case as an emergency. That might be an emergency for a date, but it may not be an emergency for a relief of pain. But as long as we document that what we're doing is getting people out of trouble until, then we can do that. So I've got some clients. I've got a client who is the ideal client. He doesn't need me. And so what he's done in his office is very simple. He just moved everybody's appointment back 3 months, keeps in touch with those people, but he's open every day to do emergency treatment for anybody in the area who contacts his office. And he's busy on a daily basis just getting people out of pain. Now, there's a win in that because those people will tell their friends that, oh, hey, if you need an emergency dentist, this guy's okay, and he's open. The second thing is that some of those people, he says, well, now you can go back to your own dentist, and they go, look, you're a better dentist than my dentist, so I'm going to come back here. So you've got to remember that if you shut your office and your patients love you, but they fall into that category, they need treatment, then they might end up going to a dentist that they like better than you just because you weren't open. And so it's not everybody that's shut. If it was everybody was shut and nobody could get treatment, then we're all on a level playing field. But we still got the playing field uneven. So what can we do to make sure that we are stopping, this is a Dan Kennedy term, controlling our herd, protecting our herd. We've got to be available for those people. The second thing that we need to be doing, Stephen, in our practice is for every patient that's got an appointment, and we need to make sure that we're on top of those numbers. How many people have we got an appointment for, from when we anticipate? Let's say we anticipate we open in July 1. So let's have a look at July 1. We should be contacting all those patients in July on a weekly basis, just ringing up to see that everything's okay, just letting you know that we're on top of the situation. Is there anything you need? It's not just dental. Is there anything you need? Are you having trouble getting out? Because some of these people, they're not even hearing from their kids as often as they would be hearing from their dentist, but they'd be hearing from their friends, and they say, my dentist rings me every week just to see how I'm going. There's nothing wrong with doing that, just keeping in touch with people. So be on top, because, I was talking to one office, they said, yeah, we get them out of pain. We ring them the next day to make sure we got them out of pain, make an appointment for 3 months' time, and then we don't talk to them. And I said, well, you need to be talking to those people weekly at a time and allocate it. The other thing that we can do in our office is work out every practitioner, every hygienist, every dentist, make a list of your top 20 patients and just be calling them just to say hi on a weekly basis. Hi, why are you calling me? Because you're one of my favorite patients, and I want to just make sure that you're going okay in this. This is a time to build relationships. You're right. We spoke before. This is not a time for Netflix. This is a time where we need to be actually even talking to our family, contacting those relatives that we haven't seen for a while, so we can do some social for ourselves. But in terms of our patients, closing the door may be cost effective. We may be running at a less of a loss if we're just doing a couple of emergencies a day, but think of the protection of our herd. That's the protection of our loyal patients. That's what a lot of dentists are missing. And so if we're preparing that we're opening in July 1, and then all of a sudden the government says, no, we're going to open June 12, or we're going to open May 28, we're ready because we've already been talking to these people, and we can just bring them forward. Whereas if we're not talking to them, some patients are going to say, I'm happy to wait till July 1. And then July 1, and they go, oh, sorry, I forgot. So we can do a lot of communication stuff in the meantime.
Well, I think I've and I talked to a lot of practices, a lot of practice owners, and they seem to be in two camps. One is, we're not sure what it's going to look like when it comes back. It's going to ramp like this. And the other is, they plan already, if they're closed on Friday normally, they're planning on working Fridays. And they're planning on working late the rest of the week. And the reason being, you have I don't know, you're right. We come back in June or so. You have a 3-month gap in a couple of things. One is patient maintenance, that you want to keep them as close to that 6-month cycle as you can. And number two, in revenue, here you're generating roughly on average $3 of restorative off of every dollar of hygiene. So if you're not doing those hygiene visits, it's not a matter of saying, well, it's only $100 and, they missed one visit. it's a $400 visit times all the patients that you just said, well, we'll push you off till October. So to your point, I think there are a lot of practice owners that don't realize that's what their staff is doing right now. And I know one in particular that I called, and I said, do you realize, I mean, I'm just trying to pick your brain. Why is it that you're just totally skipping a hygiene visit? Number one, because it's a bad message to send. You know, you didn't really need it anyway. But number two, I mean, your revenue has got a giant hole in it. And he said, what do you mean we're pushing them off till October? Had no idea. So she was treating it like a normal, like we had a snow day. You know, it's a, you know, darn it, it's a snow day. The schedule's jammed for the next, 6 months. So we'll just push them off till then. This isn't a snow day. This is a snow quarter. And, you know, your practice can't really afford that. So I agree wholeheartedly. And I think a lot of docs and practice owners, they're afraid to reach out to their patients like that, aren't they? They feel like they're bothering them.
Yeah. And you know, you've only got to be told by a patient when you call them and you say, look, haven't seen you for a while. And they say, well, we haven't heard from you for a while. We're going elsewhere because we didn't think you didn't care.
Yeah.
We've got to be the instigator of the relationship and not just be waiting for these people. And, you know, we'd rather know rather than hope that they're coming back, we'd rather know that they are coming back. But a lot of people, you know, they often forget. In fact, Stephen, here's just a little tip. Some people who ring a dental office for the first time, take COVID out, they ring a dental office for the first time, they don't make an appointment. We assume that they'll never that they've gone somewhere else. But a lot of those people have never made an appointment. Something comes up, they forget about it. We ring them back in 3 days later, say, hey, you rang our office about some Invisalign, just ring up to make sure you got in somewhere. They say, actually, I didn't. Thanks for ringing back. Can I get in with you? So, you know, how that happens to us. How often do we walk into a room and we go, what did I come in here for? Oh, there's a squirrel, you know, and we get distracted. And we forget that our patients and our new patients are doing the same thing. What I'm suggesting for my patients, my clients, is that, and hygiene down here is way behind the level of attention that the US has.
Okay.
But I'm saying you're right. You've got an appointment now in April. Let's schedule your appointment in October in 6 months. But what I'm doing, I'm going to schedule your April appointment now for July. We're going to bring that forward, or we're going to bump it back. But we've still got you. You're still in 12 months going to have those 2 appointments. We're just going to have to maneuver one. But we don't want to move you back. And so you have this 10-month gap that never recovers. I'm going the wrong way. Sorry, I meant to be going that way. We're down under. We're upside down. The water goes down the toilet, down the sink, the opposite direction.
So yeah, it's the end of the day here for me, and it's early in the morning for you, right?
Yeah, 8 o'clock now. I'm watching the sun out there. Yeah, glorious. And it's tomorrow. So you remember back in 2012 with the Mayan calendar and the world was going to end. I was telling all my American friends, just ring me up, and if I'm there in the future, then you know that the world hasn't ended.
Right. Well, and so I think what you're saying really is just be proactive rather than reactive. Is, you know, now's a good time, and you know there are a lot of patients that are thrilled to hear from you and that you care. So what's something else so if I'm here as a practice owner, and I also, let me back up. I don't think a lot of practice owners realize that they are the dentist. They're a healthcare professional. Their patients appreciate hearing from them and that they care. I think that's an important message, just that your doctor is checking and, you know, cares. And I agree with you. So do you see that? Do you feel that hesitation that they just talk themselves out of reaching out to patients?
They do. And you know, dentists, you know, when you use the disc profile, a lot of them are, you know, majority of them are all in the C category. You know, they're the detail guys, the engineers, and they're not really the people. So it's a challenge for them to be a people person. Now, a lot of us put on that challenge well, and sold that challenge during the office. And then when we get home, we're all peopled out because that's what we've been doing all day, and we don't want to people with the people who we care about the most. That's an issue that we have as well. But we've got to encourage relationships. You know, people. It's a cliche, but people don't care what you say. They don't care what you do, but they'll remember how you made them feel. And so that's important. It's so nice for them to hear from you. And so the dentist should be taking some role in this. The practitioners should be taking some role in this, because a lot of your patients, even the ones who you only see for that 5 minutes, say hello, everything's fine in the hygiene room, still feel that you're their best friend and they know all about you because of their visit to your establishment, even though you're off with, you know, restorative patients and you're not seeing the hygiene patients that much. But the other thing that we've got here, Stephen, and I don't know if you've had this, you're a practice owner. As a coach, I find it one of my biggest challenges with my clients is getting them to actually start structuring their appointment book in a pre-blocked, templated manner. Oh, it's all too hard. When do I start that? And so every time I'm looking there at their schedule, it's just like a logjam. It's like a really badly organized closet. And now is the time, because we've got clean paper in July. Why don't we say, well, this is how I'm going to start doing it. I'm going to move these people to where I want. So it's kind of like, you know, one of the things about tidying up your closet is you got to move all your stuff out and then put it back in the same spot. This is kind of like doing an extension, because you can move it out and put it where you want straight away without having to put it somewhere and bring it back. So this is a real opportunity for people who have those up and down days. You know, they have those $4,000 days and then the $1,500 days and then the $10,000 day. Now they can say, I want a $5,000 day every day. I want to know if I get out of bed, I go in, I come home, there's $5,000 worth of dentistry done. This is what I need. You know, 2 or 3 crowns a day. Boom, boom, boom. You know, 1 crown a day. You pick what your level you're comfortable with, but do it. Don't have a 5 crown day and then a week of nothing, and you find that, you know, I cruise through the 5 crown day, and then, you know, then I'm doing rats and mice stuff for the rest of the week, and I make no money, and I'm worn out. I go, $800, is that all I did? You know, now's the time. This is a real opportunity to say, let's get it structured. Let's put these people where we want.
It kind of is. It's a reboot. So you have, you know, and I know a lot of people who block schedule, and they really intend to block schedule, and they do well at the beginning until nice Mrs. Jones calls, and then they stick her in where they shouldn't be. And then now 3 years later, it's just this hodgepodge of everything. And we think we're block scheduling, except, you know, why are we seating a crown, you know, right before lunch? Or why are we doing a denture adjustment, you know, with 15 minutes before lunch when nobody's having lunch? And so now is a good time, right? It's a blank slate. And if there's treatment maybe you don't like to do or want to do, you know, if you're not good with kids, it might be a good time to say, you know what, we see kids on this day and this day only. So rather than being reactive in your schedule, here it is again, rather than being reactive in your schedule, you can be proactive and say just that. Mrs. Jones, we're scheduling for July. I've got Tuesday afternoons open for your treatment. How does that look? Well, nobody has a full schedule in July right now, even on the patient side. You know, you and I do because we work with dentists, but in the dental world, nobody, everybody's schedule is blank. So that's a great idea. Just think of it that way. You know, you be in charge of your schedule rather than your schedule running you.
That's exactly right. And, you know, you'll get people say, Stephen, I don't know what I'm doing on the 15th of July. And your girl will say, yes, well, I know what you're doing. You're coming to see us. And lead them straight into the appointment. Yeah. And remember, the purpose of every appointment is to make an appointment. So when we're on the phone, we've got to be making that appointment. Even if they say, well, look, I don't know what I'm doing. Well, let's make an appointment to call them. Let's say, well, look, I'm going to call you next week, Tuesday, 12 o'clock, and you'll have your diary then. We'll schedule it then. But make an appointment. Don't leave it up to them. Bring it back to you're in control. It's your appointment schedule. You're in control of it. But everybody needs an appointment. There's only two reasons they can't have an appointment. One is they've left the planet, and the other, or left the building. The other is that they have just moved so far away that they still don't come back. But I used to have a patient lived in Shanghai, and he'd visit Australia 4 times a year, and twice of those 4 visits he'd be coming to me as the dentist. I'm sure they got dentists in Shanghai.
Yeah, but yeah, that's exactly, I think that's the point. That's what you're saying, is don't let again, be proactive, not reactive, but don't let the patient dictate to you, not that they can't, but yeah, there are no boundaries. And maybe, the neat thing about it is you create a new sort of culture and atmosphere with your patient that they expect some kind of a decision. I love what you said. Every appointment has an appointment, even if it's when they say, I don't know right now. Okay, I'll call you Friday. When will you know? Is it okay to call you Friday? Get that agreement. But versus, I don't know right now, and I'll call you when I figure it out, and you check them off the list, or your staff checks them off the list and says, okay, we're going to wait for Mrs. Jones to call back. I don't know what the number is, but it's a very high percentage that just don't call back. And so again, I love that. I'm going to write that down. Did you write that? Every appointment should be about setting an appointment.
You know where I got that? A doctor friend told me that he heard it from somebody. This is 30 years ago. He heard it from someone in Amway. Remember the old cassette? They'd give you a cassette tape, and if you didn't listen, they'd still say, "Oh, that's okay. I'll come around. I got another one for you."
Right.
It's not about the tape. It's about the appointment and just building that relationship. And so every patient has to leave with an appointment. What's the next step? Well, I've got to come back. What are you coming back for? You're coming back so I can check. Every hygiene visit is to check something specific, not because you're on our 6-month plan. I want to check that recession. I want to check that bone loss. I'm going to be checking, that sensitivity. I want to check that tooth mobility. There's the reason. Not, oh yeah, well, you're due. It's like my car is due.
Well, that's a great mindset for your patient to be in. That's a relationship. There's a reason for you to come back, not just because it's 6 months. Sometime between now and 6 months, they may pass a really shiny new dental office, on their way home, and decide that, maybe this time I'll try this person who has a really strong staff and system. And now, they're a new patient down the street, and you don't notice that for a year, and you reach out and they say, oh, well, I meant to call you. They won't tell you this, of course, but, I meant to call you back, but I forgot. And now I go over here. So, I love that. And you're right. This is a gift of time. You can binge watch on Netflix, or you can be at your office being productive, working on your practice instead of in your practice. So those are great.
The other one, here's another one for you, Stephen, because this is a time where you can actually be doing some damage by telling your patients that you're going to be calling them, that you're putting them on a list, right? Nobody likes to think they're on a list, Everybody likes to think that they're the first person, they're the only person you're going to call. So, we always tell every patient at the completion of their appointment, Betty, I'm going to get you in next week to fix that tooth. But I'll tell you this, if I get a change in my book, I'm going to be calling you, and I'm going to be bringing you in sooner. All right. Now that means everybody who I see, because I'm telling everybody, they're all on my standby list, but they don't know that they're on it, but they feel like they're the only one. And so at this time where we actually are making lists because we can't be doing stuff, we still got to not tell them, I'm going to be calling you. You'll be on my list to call us. No, I'm going to be calling you first. As soon as their doors open and we know the date, I'm calling you first so we can bring that forward.
It's our language. It's the language we choose to use. And I think, you tell me your opinion, but a lot of practice owners are disconnected from that part of their business. They think, one of my favorite things has always been the sort of secret shopper calls, where you call your own practice, or you have a friend call your own practice. And, the way it works is you call your practice at the best time of day and say, hey, I just moved to town. you know, I'm an executive at this really big company over here. My wife and 2.3 kids and I are just looking for a new dentist. Do you do, you know, root canals? And your staff will say, oh, yes. And you'll say, all right, well, let me think about it. Let me look around and I'll call you back, you know, if I want to get a root canal. And your staff says, okay, hope we hear from you, and hang up. And you hear they're in a hurry to hang up. You can hear, so there's a different argument here, and it might be how you apportion your staff's time, but you can hear they're in a hurry to get back to whatever they were doing. And you, as a huge prospect, are an inconvenience to their time because they're checking a patient out or they're calling about insurance. And their patient experience was what a real customer or patient is going to hear. I've found, you tell me, I'm going to say 90% of practice owners, docs who go through that are shocked when they hear the other side of the call. They have no idea this is going on in their practice. Is that, I mean, that patient experience category, that's error number one.
Well, there's a number of things that cause that. It's the general nature of running a dental office. It's the same as if you were an auto mechanic and had your own business. You'd be under that car all day long. You wouldn't know what's going on the phone. Right. And so how do you monitor that? You can't be out there. Like if you're running a restaurant, you're running a retail store, you can be walking the floor like Captain Peacock from that English television show. You know, you're managing the place. You're touching. You're schmoozing. But because you're actually the mechanic, you can't be on top of that. So you either have to put your head in the sand and just hope, which is not a good idea, or you have to hire somebody who trains. And so, you know, that in fact, you hit the nail on the head. That's one of the things my wife does. You know, she listens. In fact, she started training people. And they say, yeah, I'm doing that. Now she gets the recordings beforehand, and it's painful. But the teams that want to fix it are great to work with. That's I think the first thing is that we've got to make sure that we've got the right people on there, because, you know, for the girl who just hangs up and says, yeah, that's okay, and thinks I helped that person because I was nice to them, but you didn't really help them. She gets a lot of officers. She gets paid the same amount of money whether she makes an appointment or not. And so we've got to incentivize those people to answer the phone quicker, make appointments. We can't incentivize them as a unit. We got to incentivize them individually, so they're actually competing or at least balancing amongst themselves. How many have you got? Are you going to get that call? I'll get that call. All right, no, I need to catch up, so I'll get that call, as long as they're both good. But we also need to incentivize, just like running a football team. We know if we call them wingers, but you call them wide receivers. That's right. If our wide receiver on the left side is catching better and running further than our wide receiver on the right, like 2-to-1 distance and catches percentages, we're going to be throwing left more than we're throwing right. So we've got to know who's doing well. And if our right guy needs some work, we don't say, well, we'll just keep playing left, because everyone will work that out. Mm-hmm. We've got to help our right guy get better. And so it's the same in our office. We've got to work like geese and flying birds. They will always send one back for the weaker bird until it either dies or it improves. You know, we've got to help our team in that way as well. So there's a whole pile of stuff that dentists don't do. But Stephen, you've probably seen this as an owner. Half the dentists in the world, I've had this discussion with other friends of mine in dental consulting in the US. Half the dentists in the US, they don't even want to be dentists. Right. Right. They're either locked in, their parents made them do it, then they're married into mortgages, and that's just all they can do just to get by until they can hang up and do something else, go fishing. And if I was a patient in an office like that, I'd be really sad, because you want a dentist who's excited about what he's doing. You want a dentist who also want a dentist who charges a fair price, who takes a vacation, doesn't need a vacation. Last thing you want to be is a patient at a dentist who, I'm hanging out for Friday. You don't want to be the Friday patient.
Right, right. Well, and so I have a theory on that. And when I speak, I speak on mindsets, and one is the dentist mindset versus the practice owner mindset. And what I have realized, I think, is that it's not dentists who don't want to be dentists. It's dentists who don't want to be practice owners. They like the dentistry. That's fine. But, you know, there's this neat phenomenon that occurred in dentistry for who knows what reason. In fact, I have that question when I'm speaking, and I have a slide that says, what percentage of professionals own their own business? And, it's 6% of attorneys, it's 9% of accountants, and they're mostly bookkeepers who, just have an accounting degree. And it's these little bitty percentages. And when you come to dentistry, it's 86% own their own business. So they went to school to be a clinician. You went to school to be a dentist, and for 4 years you learned protocol. You start here, you follow these steps, you end here. Well, in business, it couldn't be more different. It is all gut. Should I refinance this? Should I pay for that? Should I buy this piece of equipment? So the dentist mindset says, let me do some math and let me follow a protocol and I'll have the answer. And it's tangible. I can see it when I'm finished with this procedure. And in business, sometimes you don't know for a week or a year or 10 years. And I think that's what's going on right now is dentists are a million miles from their comfort zone, that structure and protocol. There's nobody on earth who can tell us when you're going to get back to business so you can start that protocol. When we pull the trigger and say, this is what we're going to do, here's our action plan for going back, that starts on this date. Literally nobody on the planet Earth knows that date. What's it going to look like? Nobody knows. What are your patients going to be thinking and what's important to them? Nobody on this planet knows that. To a dentist mindset, that is, it's overwhelming. So that's why I think this is an interesting conversation in that, practice owners need to be doing something. They want to be doing something. They want to be doing dentistry. But guess what? They literally can do zero. They can do emergencies, and they should. But the kind of dentistry they want to do, a cosmetic case or an implant case or the things they like to do, in fact, some places it's illegal to be doing it. So the struggle, I think, are dentists who want to be dentists, but they happen to be 8.5 out of 10 of them happen to be a practice owner too. So so if somebody, this patient experience sort of focus or component, what is it, like a hands-on thing that somebody could be doing? Can they work on a patient experience plan? Are there things, they're not seeing patients, so they can't do a lot of, and they're not getting calls for, to schedule appointments, and they're not reappointing hygiene. Hands-on tactically, what can they be doing today to get a patient experience mindset so that when they come back, they just are rolling with it?
Really good question. And it's funny because this week on 2 days ago, I did a presentation. I got asked by a practice owner in New York who asked me, he said, I've got 8 practices. Can you do a live call? So I thought, yeah. So I said, about, he said, I want my team, while we're shut down, he said, I want them building and working on the, building an ultimate patient experience, going through the process. Can you do it like an introductory call? I said, yeah, all right, 2 hours, I'll do it. And so I get on a Zoom meeting. I ran the Zoom meeting. I'm expecting 8 windows. There was 72 windows. Like everybody in every office was on it. It was like the Brady Bunch times 3, 3 lots of 32. And I'm going, what is going on here? Mm-hmm. But he came down to, he pulled out some really, I just talked about, I deep dived into a couple of things that people see. Most dental practices, they just think the way to be successful is do more marketing and be better at case acceptance. But there is so much in the middle that if your marketing is good, and as soon as the patient walks in your office, it looks like a rat hole compared to your marketing, they're going to be upset. If they're sitting around in your what you call your lounge, but they call it a waiting room or more like a Turkish prison, and they don't see anybody talking to them because they're talking to each other behind computer screens. By the time they get down to the dentist, even if he's the best case presenter in the world, they're not going to be buying anything in that office. And so they walk out, they make an excuse, and the dentist says, I don't think they had the money. Well, they probably had the money. That's because they were there. They wanted to buy. They weren't there because they had a spare half hour they wanted to waste. They were there because they wanted the dentistry. They just made the wrong decision. But if we can fix those things, if we can have a concierge, if we can make sure that our office looks great, we can have a concierge who sits with them and chats with them and visits with them so that they don't sink into that sinkhole of, oh, I'm nervous. When are they going to call me? Why is nobody talking to me? Geez, these people are rude. They're drinking coffee more than they're worried about me. If we can keep them up on that level, that it's like the Wizard of Oz, Stephen. By the time Dorothy met the wizard, she knew that he was the only person who was going to get her back to Kansas, despite the fact that he was just some little old man behind a curtain. It was the journey along the way. And that's what I build in my ultimate patient experience is I say everybody's part of the journey. When a patient comes in for any treatment, there are 14 steps that they go through, and the dentist is involved in 3 of them. One is saying hello, one is saying goodbye, one is doing. So really the dentist is really involved in 1, and the other 13, the staff are involved, the team's involved. So when they realize that, they go, oh, hey, hang on, I can really influence this. Plus the other people are influencing, just again, back to the football team. You can be the best quarterback, but if the guys can't catch and then the defense is just letting people in, doesn't matter how many passes you're throwing if you're still trying to play catch up. And so when our team knows this, when our dentist knows that they can be the best dentist, but their team's letting them down, or our front office person is letting them down, or even one DA, and it's dental assistant, it's purely because maybe they haven't been trained, they haven't been educated, they don't know what to say. It's not that they're bad people, we just haven't taught them. So this meeting that I did 2 days ago, it went for 2 hours, and I could have gone on longer. I was, the endorphins were really running. I was really excited, and these guys were really enjoying it. But he's now going to say, he then ended and said, he picked out something that I thought was just a throwaway line. He said, why aren't we doing that in our office? And I thought, I thought that was just a little throwaway idea. But he said, it's full of these little nuggets. And that's what we know when we go to a Ritz-Carlton. We get nugget after nugget after nugget, and we know it's a system. One nugget is not enough. One nugget is an accident to our patients. But if they start saying, oh, look, you guys know what you're doing. And so in our office, when I was running my own office, I'd hear patients before they even met me saying to the team out the front, they say, this is like no other business I've been to, let alone a dental practice. I can't believe how you're looking after us. That's the kind of thing that you're trying to build. And we can do that just because now we can't see people in the chair. We can still build relationships with our people. We can have people who we've never met, who we might our office might talk to on the phone and keep them in touch. So they say, look, you know what? I was just looking around because I want to get some veneers. I know you can't do them at the moment, but because you guys have been so nice, I'm so looking forward to when you can open and do my veneers. As opposed to, oh, we're shut, call me in July. Right. That's not what we want. So there is opportunity there. The people who call for veneers, like you said, they could be patients of your next door neighbor, and they just got an answering machine on his phone, and they call your office, and they got a human to talk to, and somebody who actually cared. Why do you need the veneer? Why do they need veneers, Stephen? They need the veneers because they've got a job interview, a date, or a wedding, or a photo shoot. We don't. A lot of time we don't even ask that. We just think, oh yeah, they need veneers. What for? There's a reason. Nobody wakes up and says, you know what, I'm going to get some veneers. I just want to look better for myself. No, I want to impress some girl, or I want to make my ex-husband jealous, or I've got to get a job. I was sitting at the cricket. Now, cricket is like baseball, but it goes longer, but it's more interesting. Right. And I overheard these 2 younger guys sitting beside me talking about somebody they knew who went to Thailand to get some veneers. Anyway, I said, what was that story? During a break, and they go, oh, it was my uncle. He went over to Thailand with $6,000 to get his teeth done so he'd look better for job interviews. Trouble was he spent it on other things, and he came back with still the same lousy teeth. Right. I thought, that's funny.
Yeah, or, so to your point, if you're just a clinical patient, or if it's just a clinical transaction, these are people who are spending a lot of money for, I never thought of it like that before. I mean, it's an emotional buy for them. They're not buying, a cosmetic dentistry because they need it. It's not functional. They want to look better. They want to feel better. They want to, suddenly they got a big windfall, or suddenly they want to change their life. Or again, you're right. Suddenly they want to make their ex jealous and move on. But there's an emotional connection. And the more you connect with that as somebody who's going to take 20 or 30 or $40,000 of their money, the more comfortable they feel giving it to you, I'm going to guess, versus, whether it's Dr. A, B, or C, who's the cheapest, who are going to do these veneers the cheapest. People like to give their money to somebody that they can say, okay, I feel comfortable giving my money. And that is your customer experience or your patient experience, I guess.
Exactly right. Now, overlying every transaction that we make in our whole lives, in the whole world, 20 to 25% of the population out there don't care what they are being charged for a service, be it lawn mowing, pool cleaning, window cleaning, hairdressing. As long as they're getting an experience that they believe is good value, they don't care what the hairdresser next door, what the guy over the road is paying his lawnmower. My guy's doing good. My guy's taking photos. He's putting them on Instagram. He's proud of and my lawn looks fine. I don't care if I can save $20 and that guy is doing not as good a job. I don't care. You ask your wife, would she change her hairdresser? Oh, no. I'm not changing. They know how to do my color. They know how to do my cut. No, they know how to blow dry. Yeah. But you can get your haircut done cheaper. Oh, no, I'm not doing that. We forget that in dentistry. One of the stories I tell, we had a lady, she sent her daughter. She was a single mother. She sent her daughter, who was 18, got her daughter's treatment done. Then she sent herself. There was just the two of them in the household. She had neglected her teeth for 10 or 15 years. So she spent a lot of money getting her teeth back to normal. She became a 3-monthly hygiene patient. But every 2 weeks, she'd have to come in to buy Curacet. Rinse. She would spend an hour in our office every 2 weeks, just visiting, just chatting, bringing photos, bringing things that she made, talking about stuff. It was a social outing for her. Did it bother us? No, because we had long appointments, so and multiple receptionists. We could do the concierging with her, have a chat, have a visit. I didn't even care whether she was a referrer or not. Just that we made her feel special.
Right.
She was not a woman with a lot of money. We just made her feel special. But that rubs off. Those people sit in your client lounge and then they direct conversations in your client lounge sometimes. Sometimes they're the schmoozers for you.
She may not have a lot of money, but she may have a lot of friends and family. Yeah. And that's the viral part of your marketing. So training right now, if you're going to, as the leader, and you can do a lot of this on Zoom. I know a lot of practice owners are having staff meetings on Zoom. So they have 8 staff and they line them up and, everybody logs in, or like yours, with a few more than 8. How would somebody, if they were going to train or they want to create this customer-centric patient experience focus, resource-wise, you have resources you share with practice owners, or I'm sure be glad to do the work yourself, but how could they find that resource right now if they say, you know what, I've got 3 more weeks. When we come back, I want our patients to know, number one, this heightened awareness of coronavirus. We're all about it. So your patient experience, and really, David, that's a good point. Your patient experience going forward needs to have a huge element of infection control and virus containment and hygiene, where not hygiene in like prophy hygiene, but hygiene in that you wipe things down and operatories are there's no germs or virus, versus 2 months ago or 3 months ago it was number 11 on the list. Now it's number 1 in your patient experience. This place better be, it better make me feel safe from a viral standpoint or contamination standpoint. So what could they be, how could they reach out or get any materials or anything that sort of helps start doing that now while they have 2 or 3 more weeks?
Stephen, probably just like doing a a new patient first appointment, probably the best thing for them to do is reach out for me, so just so I know where they are, and so that I can advise them accordingly. You know, that practice owner in New York that I spoke with 2 nights ago, he's got a big operation, eight offices plus all those people. So he's spending a lot of money. But you know, for a small single guy, might not be appropriate. Plus, just depends where they're at. Where are you at? Where are you trying to go? So get them to reach out for me. They can contact me via my website, which is theultimatepatientexperience.com. I've got some of my products listed there. I've got all my blogs listed there. You can find me on Facebook, and you find me on LinkedIn as well. Those are 2 very good places to reach out and connect with me. I'm very open. You know, I don't have a secret side or a hidden side on Facebook. And what you see is what you get. Or just send me an email to david@theupe, because that's easier to type, 6 letters, THEUPE, P for Parker, .com, and reach out to me there and say, hey, I saw you talking to Stephen Parker. We would like to know some more as to whether you can help me or not. When can we have a chat? And usually it's just a couple of questions that they answer, and you know, work out where they are. Remember, Stephen, that the dental profession has already gone through and succeeded very well in being able to treat. We treat every patient as if they have hepatitis A, B, C, right through to Z, as well as AIDS, making sure that the 10 o'clock doesn't give it to the 11 o'clock. So we should be doing the same with coronavirus. We don't want our patients coming back and saying, hey, you've spring clean. You know, it's like, right. You must have been really dirty before, and now all of a sudden you've got your act together.
Yeah.
And in fact, I'm getting that from some dentists. They say, where do you know that this is a really good time to work on our systems? I'm going, you should have your systems in place, you know, and your infection control. Yeah, we're getting the cobwebs off the windows. Yeah, right. You should be doing that all the time. That's the old broken windows, broken business. That's a great book. Broken Windows, Broken Business. That is a great book. Great little book, easy read, 1 or 2 hours. But yeah, that's the easiest way to contact me. Just find me on Facebook. I've got to be friends with someone. I'm friends with. I've still got. I'm only up about 3,000 friends, but anybody with a dental background, I'm happy to friend them to give them a hand. That's for sure. Because ultimately, you know, if everybody's got a great practice, then their patients are having a great experience, and that lifts the world. If the dental profession is a hard sell. It's like, when do I need new tires? You know, do you put them on? You put them on your car when they're smooth, or do you put them on when you think that your wife could have a smash on a wet night and maim your kids, and maybe I should do it now rather than wait another 1,000 miles?
Yeah.
You know, it's the same with your practice. You've got to get your practice nice, so that people love coming there, so that it is an experience. I'd left my business, my dental practice 5.5 years ago. I keep getting reminders on Facebook of, you know, birthdays and anniversaries of friendships for people who were patients then, who are just lurking, who still haven't disconnected me. He's not my dentist anymore. And I think, wow, you know, these people are still following my stuff, as well as those who communicate with me. And I love the fact that I have stronger relationships with some of my best patients now I was never there. Facebook wasn't that big in 2012 and 13 and 14. But now it is, and that's it's nice. I actually have my patients review my consulting work and say, yeah, you used to do that when we were your patient, you know, and that's what I love. So I'm really passionate about helping people who want to help their practice. So reach out to me, anybody who wants to. I'm happy to help.
And we'll post that. We'll put that link below. We'll put it in the show notes. But and you know, as we spoke beforehand, I'm a big believer in. I look for people to contribute to the magazine that have done it. You know, you are a practicing dentist for a long time. You know what that means. You know the ups and downs and struggles and challenges, and you've clearly made that shift in mindset to, here's the stuff that dental school taught me, here's the stuff that it didn't, and the things that you need to work on for your business. And I think a lot of docs and practice owners don't make that connection. They struggle. And so somebody who's done it and been there and not just talking about it, not somebody who graduated with an MBA and is now talking about marketing or patient experience is one thing, but somebody who has lived it has a whole lot of different perspectives. So that's why I appreciate your agreeing to come on and getting up early before the sunset or sunrise. I have the sunset, you have the sunrise. Getting up and doing that, and it is a very difficult time, but I think the overall message is you will come back if you choose to, and if you choose to come back the same. I think you said something that really jumped out at me. I'm going to spring clean. I'm going to change everything. And in your patient's mind, you're right. They're probably thinking, well, how dirty was this place? I don't really remember.
Yeah, sometimes it can be a little bit of a shock to them. Stephen, I had a chat with Howard Ferrand before COVID. We're talking 10th of March, and he was saying then, he said, the world's been through all these problems. We've been through the 87 crash. We've been through the dot-com crash. We've been through the GFC. In Australia, in Sydney, my practice in Sydney, the worst time for my practice in Sydney was during the Sydney Olympics, because half the country left the country and went overseas to get away from all the tourists, and the other half went to the Olympics, and they were going for one event, and then they go back and buy more, and so they had no money for about a year until they could finally get back. That was crickets. So I'd experienced that when people think, oh yeah, it should be an exciting time. You don't want an Olympic Games in your town. You don't want that as a distraction. It was devastating. It was see two patients, then what do? Walk down and watch the big. This is 2000. There's only one big screen out in the middle of our mall, and so I'd go down there and they'd call me. Oh, yeah, we've got a patient coming. Come back. It was crickets. That's what this is like now, except there's nobody in the mall watching track and field. But we get through it. We got through it. Since 2000, we've had 2, maybe 3 rises. People say this, it's a bad time to buy stocks. It's a bad time to buy property. We always exceed our previous low. Even when it drops down, we exceed the previous high, and up we go again. And am I going the right way? No, I'm meant to be going that way. Sorry. Anyway, you understand. We will get out of this again. But how can we make sure that we have accelerated growth and that we're at the front of the pack, not being dragged on at the end of the pack? And so the things that I've discussed with you today are the things to do to make sure that when the gates open, just like when the Macy's sale starts, we're at the door. We're not 15 back. We're going to be the leaders, and that's our actions that we can take now, and build our culture, build our relationship, build our relationships with our team, build our relationships with our patients. We don't want to be calling people and they say, we hadn't heard from you. We rang your office, you were shut, we're going elsewhere. There's a new office around the corner. We like that. We don't want to hear that. That'll just break my heart if people miss. It breaks my heart when people miss opportunity. Dentistry is such a great opportunity to live a good lifestyle, to put money away for your future, and so many people don't grab that opportunity with both hands, and yet you can. And this is a really good time to recalibrate and move forward.
Well, I agree wholeheartedly. So with that, I'd like to draw this one to a close. Dr. David Moffet, Ultimate Patient Experience. We'll put a link below how to get a hold of him. You have, first of all, you have that. I could understand almost every word you said. I don't know if you know this, but you have a little bit of an accent. I've been told I have one too, but it's a little more Southern U.S. than that. But yeah, any parting thoughts for a practice owner who's just sitting out there saying, it's gloom and doom? I mean, you're a dentist, you're a practice owner, and you've been through a few of these. Anything to any good words of advice?
Everything's done in small steps. You can chunk everything down. how do you eat a baby elephant cake? One bite at a time. You know, the journey of 1,000 miles starts with the first step, and that's what you got to do. Take the action, and sometimes taking the action is just sending me an email, getting on the phone, having a chat. You know, you can do it. Everybody has the opportunity. Dentistry is an amazing opportunity, and you can't. You know, the title of my book, How to Create the Dental Practice of Your Dreams in Less Than 60 Days. You can do it. Everybody can dream of something, and you can create it. Do it now.
Well, and I agree wholeheartedly. Take action. So good way to end that. So Dr. David Moffet, thanks for coming on.
Stephen, thank you for having me.
So practice owners, appreciate your time. Hope you got a lot of value out of this. I certainly did. I have about 2 pages of notes here as you were talking. I even have some book suggestions here that I'm going to read. Broken Windows, Broken Business. I don't even know what's in it, but it sounds smart. It sounds like exactly the kind of thing I like to read. So if you have any questions, reach out to Dr. Moffet or reach out to us at the Profitable Dentist, and we'll share those resources. So until next time, practice owners, hang in there, and looking forward to helping you come back stronger. So David, thank you.
Thanks, Stephen.